Good morning, everyone. Thank you for joining us for this September Issues and Insights. I know we're going to have a bunch more participants jumping on the line, so we will give it just another minute or two, but really excited to have our two guests with us here today, Mary Jo Williamson and Lisa Shannon, really talking about healthcare. If we're going to dive into some questions, here's a few housekeeping things for all of you that are joining us. As you know, we do this Issues and Insights in the Zoom format of the webinar. So on the bottom of your screen, if you move your mouse around, you'll see the Q&A section at the very bottom. Please put your questions in the Q&A bar at any time during the presentation. We want to make sure that we keep a very robust conversation, and we want to answer the questions that are most relevant to all of you. So if you could continue to pop questions in there, we'll get to those at the end of the presentation. So I will share my screen, and I think we will get started. So as I mentioned, we appreciate everybody being here today. We're getting a lot better at this Zoom thing. It's kind of as we've all heard, the new normal. Well, this is definitely it. We do hope that sometime soon we'll be able to get back into a hybrid approach with some in-person as well as some virtual aspects to this. So stay tuned to that. A couple more announcements that I'll give to you. As many of you know, the Issues and Insights series goes all year round. Generally, we kick off the new series in the fall in October. We actually are going to extend the current series just due to the fact that we're virtual and we're trying to give our sponsors as much recognition as we can. So we're going to extend the next few, October, November, and December within this series. In January, we'll kick off the brand new series. To all of you that attend, it's really seamless. You're not going to see a whole lot of changes until we start to add back in the in-person component to this. So really looking forward to the upcoming topics as well. I'll touch on that as we go forward in the presentation today. So the agenda for the day, as I mentioned, we've got two very special guests with us today that have given their time to share with us their expertise and thought leadership from both Mayo and Allina Health Systems. So we're looking forward to that. As a reminder, once again, all of you attending, we would really appreciate your questions. So if you use the Q&A bar at the bottom of your screen, type in your question. When we get to the Q&A component of the presentation, I'll then moderate those questions out to everybody. So as always, we can't do these events without our sponsors. We're so appreciative of the sponsorships, especially now more than ever. I know all of you as members have heard that this is a really challenging time, not only for our members, for all of you, but it's a challenging time for the chamber. We've had numerous obstacles around decreases in revenue, limited or no access to some of the grant dollars. So the CARES funding, the PPP dollars, those aren't open for chambers. So I will tell you, because we also have the majority of our revenue coming from events that we do in person, and we've now moved those to virtual and most of them at no cost. Our sponsorships now are ever more critical to us. And so to all of these sponsors that you see on your screen right now, Mille Lacs Corporate Ventures, Allina and Abbott, CenterPoint Energy, PCS Capital, Rasmussen College, Rudy Luther Toyota, and Velocity. These are both our series and our sustaining sponsors for the year, as well as our session sponsors that you see their logos and our media sponsor and in-kind sponsor. By far, this is our largest sponsored event, and we are so appreciative of each and every one of you that sponsored with us. So thank you for that continued support and sponsorship, and we'll look forward to having you with us again in the series in 2021 as well. So here we go. Let's kick it off and have some conversation about healthcare, really around, we're hearing this in the media, in the news everywhere, all about healthcare. And so healthcare has been a vital topic to us for way before COVID, but now there is a new brighter light shining on healthcare in both the media, but also in leading the way around frontline workers and really critical aspects to us in recovery and fighting COVID. So we're going to start with Mary Jo Williamson from Mayo Clinic as the Vice Chair for Administration at Mayo Clinic and the Chief Administrative Officer at Mayo Clinic Health Systems. Mary Jo previously served as the Chair for Practice Administration at Mayo Clinic, Director for Mayo Clinic Care Network, as well as roles as Vice Chair for Mayo Clinic Health Systems Administration, providing operational and programmatic leadership and ongoing initiatives and new strategic directives across the system sites. So a very experienced leader in 25 years of a career here in healthcare. And Mary Jo, I am sure that you could have never expected this, and I am so excited to hear from you today. So by all means, take it away.
Well, thank you so much for that introduction, Shannon. I feel like you could have said she's been there a long time.
Well, or that too.
So I really am so thrilled to be here today, and it is just really so stunning to think that in just January of this year, we really had no idea about this novel coronavirus. We had no scientific insights, and we certainly didn't see a pandemic coming our way. It's amazing how it's changed all of our daily lives. Certainly in healthcare, we've had a significant impact, but not lost on me that businesses across the country and most importantly within our state have really been having to reformulate how they do business, create safety protocols, and figure out ways to move forward and thrive. And I've been so impressed with the work I've seen to date, and I'm anxious to hear what your questions are. It's really interesting to think about in Minnesota that the businesses would be the key leaders in providing the response to help guide our state, especially given how this was such an unexpected and difficult time. But that leadership that you've really provided to our state, our country, and our communities is so impressive that I'm just glad to be with you here today. Unfortunately, my slides are not glad to be with me here today, and they don't seem to be. I'm going to try to restart it just a minute. I apologize.
Perfect.
Maybe we'll try going at it a different way. I think you'd get a little tired of looking at that screen for the entire time, but we could have done it if we needed to. Today, I'm really pleased to share with you some of Mayo Clinic's response and efforts to the emergence and pandemic spread of COVID-19. First, let's really think for a moment how we got here. In early 2020, the coronavirus had not yet really been reported in the United States at all. But by the end of February, it was amazing to see the spread and the domestic cases that we were starting to see. Both Mayo Clinic and the state's response followed this timeline very closely. And in late January, as the pandemic started to escalate, Mayo Clinic activated its Healthcare Incident Command Center, a step that many providers took across the state. And that really became fundamental to help us get ahead of the planning, logistics, and operations that would be required given these new challenges that were in front of us. Mayo Clinic also began ramping up pandemic response support across its three shields, and this was really inspiring to see. Both in practice, research, and education, we mobilized all of our forces to ensure that we could be here to lead and help collaborate across the state in the response to this pandemic. It really was incredible to see these types of things mobilized so quickly. And when the state started shutting down and putting in our shelter in place in March, the legislative action really had multiple state-led groups to address the various issues across COVID-19, from supply chain to PPE shortage to ICU capacity and ventilators. I'll tell you, when you came to work every day in healthcare, it was a whole new problem to solve. We really participated actively in these groups and collaborated independently with providers, both within the state and across the country. And we found ourselves, along with many others, being asked to provide information, both informally and formally on a daily basis, And we took many of our analytics tools and AI capabilities and honed them all on being able to better understand our situation and help share that information across the state. And I'm going to jump a bit into testing, which is so front and center on everyone's mind. Testing has been a strong focus of the state in its COVID-19 response, and as one of the country's leading reference laboratories at Mayo Clinic, we were well positioned to take a lead on this issue, but it wasn't without the need to really recalibrate and redistribute resources to make sure that we had all of the talent at Mayo Clinic behind this work. Mayo Clinic has completed, and it's amazing to think about just in the past several months, 1.2 million PCR molecular tests, which is the test that most of you are familiar with. But in addition to that, we've done over 200,000 serology tests, which shows if you're immune to this, if you have the immunity in your system or not, with the goal of a 24-hour turnaround, which honestly is so essential. You might not be thinking about how important that turnaround is, and of course it has a patient service impact, but it also impacts the utilization of PPE and other resources. Because when you're in that period of not knowing if someone has an active COVID infection or not, you have to take so many more precautions. So we focused very early on efficient, effective, and streamlining our processes. So first, we developed tests, both the PCR, which is the virus, and the serology, which focuses on the antibodies. And today we talk about capacity. It's easy to forget that these tests simply did not exist 1 year ago. If you had told me that one of the crippling elements of delivering a test for a virus was going to be swabs, I would have laughed. But it put such strain on the supply chain, whether it was with reagents or other supplies needed, that we were constantly problem solving to keep ahead of this curve. We did this along with other Minnesota providers to really make sure that we kept testing capacity and efficiency at the forefront. Secondly, as we ramped up capacity for our patients and our partners in the state itself, from early on in March, we repeatedly offered to the state and were in conversations with the state about additional capacity to satisfy their needs. Now, this capacity wasn't always utilized. It was difficult for people to figure out how to incorporate these new opportunities into their workflow. But we really remained committed to problem solving with the state. And third, as Mayo Clinic leveraged its vendor relationship to help with supply chain issues, this helped address shortages that would have impacted testing, and we saw impact testing in other states, and could have compromised our testing capabilities. But I'm really pleased to say, because of the dedicated effort of the team, we were able to keep this resource available for the state of Minnesota. Fourth, we really stepped up to support specific communities in need. For example, we've provided testing and support to all the tribal nations within the Minnesota's geography, and also provided ongoing support for long-term care facility testing, not to mention, of course, the communities that we have facilities within throughout Southeast Minnesota. And last but not least, and important to this audience, but certainly important to all of our fellow Minnesotans, we really worked hard to price our tests to ensure affordability and deliver on a value. Our current state contract, for example, prices the PCR test at just $62, when Medicare will actually reimburse up to $99. But this is all part of our focus on making sure we're eliminating barriers to people being able to get access to tests and make it affordable for people in need of the test. In April, the state crafted its moonshot strategy, which so many of you have heard about, and asked the Mayo Clinic, along with the University of Minnesota, who had also been developing tests, to help lead a statewide testing partnership. Though led by MDH, Mayo Clinic, and the University of Minnesota, the partnerships includes providers throughout the state, and it works very collaboratively across those partnerships in the state, and I think that's been one of the big success stories of this work. Under the partnership, the state established a virtual command center to monitor the daily testing needs, respond to outbreaks, and increase public health surveillance where needed. The University of Minnesota and Mayo work with MDH to lead these functions in a coordinated way with the provider groups across the state. And I'll tell you, there's a lot of activity going on in this command center. As a result of the partnership, Minnesota has increased its testing capacity to over 20,000 tests daily, And of July 31st in 2020, the partnership has supported 1 million tests in the state, of which Mayo Clinic processed almost half of. So it's really an incredible effort across the entire state, and we were so honored to be part of it and to bring our expertise to the table. Testing is essential, but of course not sufficient. We must also be able to care for patients and to treat COVID-19 effectively and efficiently. Mayo deployed its integrated model of practice, research, and education to meet this challenge. And I have to tell you, being part of these daily meetings where we have some of the best minds in medicine coming together to problem solve, it was probably will be the highlight of my career. For example, early in the pandemic, there was concern about bed space and ventilators. You can recall the stories from Italy, which was caught very off guard in the pandemic. And of course, manufacturing enough ventilators really wasn't an option and couldn't be delivered fast enough, although this increase in supply certainly was a key. What we focused on was delivering new protocols to help reduce the time on ventilator, help manage as many patients as possible in an outpatient setting. This was really better for patients and freed up bed and ventilators for the patients that really needed it. And I have to say, I think as we look back at our experience throughout the pandemic, we will see this very aggressive triaging and movement of patients to lower levels of care as one of our most successful parts of this pandemic response. Mayo Clinic is bringing its powerful resources to fight COVID-19, which I'm sure is no surprise to you. But what might be a surprise is that we have about 4,000 research scientists across our organization. When we issued a challenge at the beginning of this pandemic, over half of those researchers set aside what they were doing and focused into an internal challenge to develop novel approaches to dealing with COVID-19. That's 2,000 scientists spending all day and all night working to solve these problems. It was really incredible to watch. With this push, by May, there were already 800 clinical trials worldwide for potential therapies, and we were part of many of those. Beyond Mayo, many researchers are working on clinical trials, so we not only develop our own approaches, but we participate in these drug trials using our robust research and vetting process to help evaluate and accelerate proposals, whether they started within Mayo Clinic or they started in other organizations. Mayo Clinic was really honored to be designated as the lead institution for the government-supported convalescent plasma expanded access program, which is often referred to as EAP this spring. Now it's funny, like many things in COVID, it became a bit political over the past month, but we're really pleased to see this continue to be on the forefront of options and treatments because we have seen such effective results from the use of the EAP treatment. This program focuses on collecting plasma of COVID-19 patients who have recovered and using it to treat those still experiencing severe cases of the virus. The hope is the plasma infusions will reduce the patient mortality and shorten the length of illness. And recently, the FDA, much to our delight, authorized emergency use of the convalescent plasma, and the National EAP announced its intention to discontinue enrollment in studies. And for those of you who don't live and breathe in the academic environment, this is unusual and sometimes critical, because what it means is we won't have the peer-reviewed studies that you normally have. But the early observations were so positive that they have opened up the use of EAP to all providers meeting the criteria that's been set out. This expanded access program, we hope, will increase access to the investigational convalescent plasma and evaluate the safety of this experimental program. And we're very excited to see this go into its next phase. The 5-month program expanded to thousands of sites and really included, amazingly, tens of thousands of physicians and reached tens of thousands of patients. And we think this is one of the real success stories that we've seen in the United States response to COVID-19. Additionally, Mayo Clinic has a biobank which houses COVID-19 data from around the world and will be used to identify new therapies, discover new drugs, and allow us to continue to be nimble and in our approach to developing other novel treatments and vaccines. I'd like to shift gears a little bit because in addition to testing and treatments, assessing COVID-19 requires understanding how the virus is spreading. Minnesota Department of Health and the University of Minnesota have led the state's contact tracing efforts, a process by which healthcare workers track down how many people have been exposed to the virus. Our efforts have included developing a strong internal and community tracing to mitigate the spread, especially around the safety of our staff and our patients. Developing advanced models tailored to Mayo Clinic, and it's built on an advanced data set. It's amazing how many ways AI and some of the data analytics that we've been working on were able to be quickly applied to the work we're doing here. And working with partners such as MIT-based references and others, there are all kinds of tracing apps and other things that are very exciting and really help keep our arms around this, because certainly as we've seen in other countries, we expect even as we improve our approach to this, we will continue to see many outbreaks, and getting our arms around them quickly is key. So beyond responding to the COVID-19 pandemic, we also must understand how best to use it to transform moving forward. And I know many of you would share similar experiences about the order of magnitude of change that you saw. Certainly Mayo Clinic will continue to research and transform our understanding of how to treat COVID-19 and other future pandemics. But the research will not only include medical efforts such as identifying vaccines, etc., but also understanding how to create and mitigate virus spread and best educate people to protect themselves from public risks. Perhaps the greatest transformation from COVID-19 will be the practice of healthcare itself. The pandemic has catalyzed the use of remote care and telehealth, allowing patients to access care without risking transmission and advancing technologies that we had difficult getting traction on prior to the pandemic. And so we're very excited to continue this work. Following prohibition on non-emergent procedures, we really worked tirelessly to create safe pathways for patients to receive care, including the rapid expansion of virtual visits. And it was amazing. I think in a very short period of time, we surpassed the total number of electronic visits that we had done. And we have many partners in this work. We've been working to find best practices for businesses. We've worked with Delta Airlines and others, their employers and their customers. And at the end of June, we announced these deepening relationships to help organizations like Delta improve safety and mitigate transmission. A few weeks ago, we just announced another one of these exciting business collaboratives with McDonald's. And we look forward to being a part of helping businesses operate safely in this environment as we continue to work through different stages of this pandemic. Last but not least, COVID-19 really further exposed the challenge of finding credible and trusted information. It's amazing how the internet has impacted our ability and created so many data sources, it's difficult to sort through. Mayo Clinic is striving to find ways to make sure we remain a credible and relevant and well-used source of trusted information, and our efforts include over 300 scholarly activities, webinars, interviews, and other media, which we've become much more active in a way to help create a grounding source of credible information along with many of our academic colleagues. COVID-19 pandemic is first and foremost a global healthcare crisis. But at the same time we're battling this healthcare crisis, we're also facing the resulting financial crisis. I know many of you are feeling this acutely and are struggling with this new reality. With the onset of COVID-19, Mayo Clinic proactively made the difficult decision to postpone elective patient care. And I just want to let you know, when you say elective care, many people think of cosmetics or other things, but elective care is anything that's non-emergent. It can be hip replacements, other significant life-altering treatments, basically anything that's not trauma. While it was the right decision because we realized we needed to shut our practice down and get our arms around safety protocols and procedures so that we could reactivate the practice to operate safely, it eliminated the majority of our revenue and had a significant impact on our ability to serve patients. At the same time, we were continuing to make investments to develop and expand testing and expand research to stop the pandemic and realign our facilities and care teams. I know we share your challenges with the additional costs and staffing that COVID-19 has brought to the table just to do business. But due to a strong 2019 performance and strong financial reserves, we were able to protect our staff salaries for many weeks, despite being able to operate. We went down to 10% of our traditional volume. And just to give you a sense of order of magnitude, on the Rochester campus alone, we have 10,000 patients coming through a day. It was unbelievable. I never thought I'd walk through our halls of our organization and see such space, and I hope I never see it again, to be honest with you. All of this really put the Mayo Clinic mission at risk. It led us to take historic steps of reducing salaries for most staff and furloughing staff where needed. And of course, we asked our senior leaders to take largest cuts as we work to try to preserve our workforce and the frontline staff. With the resumption of non-emergent services in May and a strong demand for our services, because once again, these things that were being postponed are life-altering, and many people were in need of care. We have been able to restore salaries and are returning all of our employees to work from furlough. And honestly, nothing has been more gratifying to see those things come into play. We've also had to reshape and refine our practice to create a safe environment for our patients and staff. Like many organizations, we've implemented door screeners, visitor policies, check-in, waiting room policies, where you can eat, where you can't eat, masking. I mean, the list goes on and on. I try to work at our screening front door every couple of weeks just to get a sense of what our patients are going through with the new safety procedures. And I'm pleased to say that we've been able to pivot and operate quite successfully with this new environment. Additionally, we've been able to refine safety measures to allow our practice to operate more fully. For instance, early on, there was concern of how quickly you could turn over procedure rooms. With this disease being spread through aerosolized molecules, it was a concern that you needed to wait almost up to an hour before you could reuse a procedure room. Well, at a high volume practice like Mayo Clinic, you can only begin to imagine how that would impact the number of patients that we've seen. So we got busy and we did the science and we developed processes and protocols. We evaluated every single one of our procedure rooms to make sure that we understood how quickly we could turn over that room without putting our staff and patients at risk. And I am thrilled to say we went from a 50% increase in turnover time to being back at our normal baseline through these improved safety protocols. And this is a huge impact, not just our financial performance and our ability to employ staff, but to the patients that we serve. Other measures that we've taken to protect patients and staff has been our transition to our non-patient staff facing working remotely. And I'll tell you, that is a big shift for us. We are a relationship-based culture, but we knew that we need to bring down the population density of our campuses in order to provide social distancing opportunities wherever possible and keep people safe. This model has proven very effective. I'm sure many of you have had similar experiences, and we'll be continuing it through the end of the year, and I would guess into 2021, as we define what our next normal will be. Now, while this additional flexibility provides greater support and safety for our staff, it does provide challenges as to how we pivot. And it reflects our ongoing and deep commitment to Minnesota as our home, as a flagship and destination, that we will continue to keep this workforce anchored in the state. And as Mayo and our many wonderful Minnesota company colleagues make these transitions, we look forward to sharing best practices and learning for you. I just want to thank you again for letting me share some of these lessons learned on behalf of Mayo Clinic, share a little bit of our journey. I just would close by saying I've never been more proud and more inspired than I have in the last 9 months, not just by the staff of our organization, but our colleagues throughout the state. Thank you very much.
Great. Thank you, Mary Jo. Wow, that was a fascinating presentation, and I'm really excited to have some questions after we hear from Lisa. But thank you for the commitment that you, your leadership team, and the entire Mayo workforce contributes here to the state of Minnesota. It makes us very proud to be in this state when we've got great healthcare like Mayo and also now like Allina. So we're going to shift gears to Lisa Shannon. Lisa is the Executive Vice President and Chief Operating Officer for Allina Health. Ms. Shannon is responsible for, oops, see, there your bio just went away. At least I could say whatever I wanted about you if Ms. Shannon's responsible for overseeing and integrating Allina Health's healthcare's delivery system, including the hospital's primary and specialty care divisions and service lines, safety, quality, information services, improvement systems, and strategic plan execution throughout the entire Allina Health system. In her role, Ms. Shannon helps drive exceptional clinical, operational, and financial performance so that Allina Health can deliver quality, affordable care to the communities that it serves. Again, we are so lucky and privileged to have such a great thought leader with us today. Lisa, thank you for your time, and we look forward to your comments.
Yeah, well, good morning, and thank you, Shannon. I really appreciate the invitation to join. And Mary Jo, it's good to see you virtually and share the Q&A time together. So really appreciate your presentation and the information as well. You know, when we were asked to join this, it was really a question that we've been thinking deeply about, which is how has this pandemic impacted healthcare? What is the focus today and what is the focus in the future? And what I really appreciated was the question, Shannon and others that came out, which is what have we learned? And so what I'd like to do today is certainly building on much of what Mary Jo has shared, not to be repetitive, but perhaps take an angle of, as we look at our industry and really important to us, our communities, what have been the implications of COVID? And I want to start here. I want to start by reflecting not only on just COVID, although we're certainly going to talk about COVID, what we organizationally have learned from it and what we think is going to be so important for our community, our employers, our healthcare industry, but also the layered crises that we're dealing with as a society right now. And, you know, I'll start with, I really appreciated in the chat as well, the recognition of what today marks. As we are together gathered 19 years ago, our country faced a tremendous crisis, and the Twin Towers and 9/11 forever stays with us. So just my thoughts to all that have been impacted. I know this day marks a lot for so many, and certainly our country. We, 19 years later, are dealing with additional crises. And those crises are the pandemic, as well as the layers that have come in from the systemic racism. And it has shined a very bright light on health inequities. COVID has disproportionately affected communities of color. And we take that really seriously. And so we think about what are all these environmental impacts and how do we, not only through Allina Health, but our broad community, become part of a solution to really forever change what has been created of recent from all of this. Now, one of the things that we've tried really hard though to do is say, in the midst of all of this, and in the midst of an environment that sometimes can be really challenging, where are the silver linings? And what I would suggest and offer, and I've said this for years, most of my entire career, that healthcare is an industry desperately in need of transformation. We are unaffordable for far too many. We have serious safety events that we can do better with, and we need to create more accessible, more equitable care. What COVID does, and all that surrounds it, is propels our transformation. Not only the science of how critical, and we're so grateful for all the researchers and our participation in research activity and initiatives as well is really important to us. And this is our opportunity to say, what are we going to do different? When we recover from this, we talk a lot about at Allina Health that we're going to recover to something different. We're not recovering back to the way we were, because the way we were isn't sufficient for our community's need as an industry. We're going to recover to something different, and we're going to be keeping close to our hearts and our heads not only the impact of COVID, but the impact of racism and inequities that we believe to be a public health crisis as well. And so, as I often do, I want to start with gratitude. And when we think about, as Mary Jo pointed out, just the inspiring work of our clinicians, I'm in awe. And I'm in awe of the heroes that have not only said, in this uncertain, uncomfortable, frightening time, I'm going to lean in and I'm going to be at work, and I'm going to know that the personal protective equipment and my role as a healthcare employee, this is what I trained for. This is what I'm here for. I want to bring my best science, my best care, my best compassion at a time that was very difficult. And I just want to first recognize my colleagues across the entire industry, and certainly those close to me at Allina Health, with all the work that we did, everyone from our frontline caregivers, frankly, our IT department. You talk about a group that got stretched beyond what any of us imagined with all the remote work, with all the virtual care. Our virtual care, Mary Jo pointed this out as well, we went from 50 visits a day to 6,000. And who'd have thought? I mean, that's transformation that we're never going back from. And it's transformation that we needed, perhaps a little boost. We don't like the way it happened or why it happened. And certainly our thoughts and prayers to all who have been impacted and who have lost life from COVID and all that surrounds that. And we are pledging our commitment to ensure that we use this time to reflect on all of our lessons. And I'm going to talk a bit about a few of what have been some of our just really key learnings. One of the things that I would offer, I've been in this state now for just 3 years, and it is a complete privilege to be here with all of you. And what I hope people of Minnesota know is how unique and special our communities are. And one of the things that I've personally experienced is the level of collaboration among the healthcare systems, among the community, among employers. We really do come together. And I have seen that different here than other places I've been. And I think it's going to pay many dividends for us, not only in our ability to fight this infection, but our economic recovery, and certainly the work that we all have to do in systemic racism and health inequities. One of the things that we have said that we are going to focus on is really looking at our mission and role in the community and a whole way to better, which looks at how do we take this opportunity and all the impact that has happened to us and become all the better because of it. One of the ways that we do that is it's an economic crisis for all of us. We additionally had to furlough some of our team, have executive impact for compensation, look at how we deliver services, where we deliver. And as we look at that, very real to us are millions of dollars of losses, even after CARES Act funding. Through June, it was $152 million in loss. Fortunately, we have a really strong balance sheet, and we see a path to recover to something even better. Healthcare needs to be more affordable. And so how do we come together, not just at Allina, but as a broad community to do something unique and different? So one of the learnings I wanted to share this morning, then I'm going to just share a few other learnings that we hope are going to be really important for the business community, for our broad communities, and for us as an industry. And we've recently announced a partnership with Blue Cross Blue Shield of Minnesota that really does look at a new model of collaboration. And we think this is going to be key and critical for so many. Being paid for the things we do isn't necessarily a sustainable outcome for healthcare. Being paid for the health and well-being of a community feels right. Finding a way to ensure that we can make care more affordable, more accessible, think about home as a hub of care. And as we think about the virtual care explosion that happened because it was the safest way to deliver care, we think that's going to continue. Things like mental health is an area where we had at one point 98% of our mental health care was delivered virtually. Truly extraordinary. And we don't see that going back. Now, it may not stay 98%, but it's certainly going to stay at a very high level. And for some patients, whether it be to their own access to care, whether it be, unfortunately, to still a stigma that some have in mental health, doing so virtually is a way that they can access that care. It's more affordable and more accessible. And one of the things that we will continue to work on behalf of the community, and we're excited to help others and other providers be part of this and work with other payers, which is really how do we tie payments to quality outcomes and patient health. And so I don't want to belabor this, but just want you to know that that is among our lessons, that healthcare, we believe, should be more affordable, of the highest quality, transform at a rate that we just haven't seen in our industry. And we have that opportunity, you might say because of COVID, you might say because the light has brightly been shined on some of the issues that we're not proud of related to health inequities and access. An additional learning for us has been, how are we organizationally going to commit our resources? We're a very large employer, much like the Mayo Clinic and many others in the community. And I would just offer that we take our role as a provider first and foremost, ensuring safe, quality, outstanding outcomes with just amazing clinicians is always first. Really close to that first, though, is our role as employer. And when we think about guiding our work in the community through COVID, and we're not through it by any stretch yet, we think about our role as a healthcare provider, as an employer. We are also deeply reevaluating our role as a purchaser and an investor and as a community partner. How do we become part of the community's recovery? Not just us, Allina Health, recovering to a new way, an improved way, a whole way to better for us to deliver care, but how do we become and be an advocate and accompany our community in the recovery? And so we're doing work. We are out talking to a number of community groups. Our CEO, Dr. Penny Wheeler, has initiated a compact that we will continue to work with other community members to ensure that we are bringing forward our part to play. We have a number of initiatives for our own internal organization. Have we done enough to hire, to promote, to support? And what are we doing to ensure healthcare, not only for our own covered lives and members, but for others that we serve? One of the ways that we will continue organizationally, just perhaps I'll close with and make sure we have some time for some questions, because I know there are going to be many out there. And that is that reflecting internally for a moment, we've learned an awful lot. And as I think about the points of pride that I have for our organization and frankly our industry, we have to continue to come together. And we have to ensure that we have communication and we have reliability and we have systems that make care as close to the home as possible, available to all in our community in a very affordable way. Over 2 years ago, we initiated a high reliability journey that built structures and systems and language that would keep patients more safe and ensure safety for our employees as well. Those really came into effect when we had to stand up incident command, planning command, and use whether it's tiered huddles or other systems to communicate, learn rapidly, and share that learning out among our organization. One of the things that I want to leave all of you with, and to remind your neighbors and your friends, is that we are not through COVID, and it's going to be with us for some time. There are a few things that we can all do. As a healthcare provider, we must be able to care for COVID and non-COVID patients, not because it's economically good for us, but because we are seeing later stage cancers as patients were afraid to have screening. We need to screen our patients. We need to care. We need to have people not afraid if they have chest pain to go into the ER. And we're doing everything we can to make sure that our care is safe, and that when you enter our hospitals or our clinics, that you can be assured that everything is being done for your safety, because you should not delay your health. And delaying health is going to have some consequences. So get a flu shot. Don't delay your health. Continue to socially distance, wear your mask, and let's together continue to work on making our community an example of fighting not only COVID, but all the other issues that we are facing. Thank you very much.
Thank you, Lisa. Again, we're so excited to have some dialogue and Q&A with our two panelists in a moment. But we also, as you know, part of our Issues and Insights program is one of the most beneficial pieces of this is our ability to have access and insights from our elected officials. And we are thrilled today that we actually have Representative Kelly Morrison joining us. And I've asked her to share a few comments about this, really this topic of healthcare, because Kelly brings a ridiculous amount of experience to the table as a physician of 18 years, but also a state House representative serving District 33B. Kelly is the vice chair of the Health and Human Services Committee as well. So she interacts with this on a daily basis. And so much of what we are talking about, there are a lot of aspects of this that the legislature is working on. And so, Kelly, would you mind sharing some of your thoughts and a little bit of an update with us today?
I'd be happy to. Thanks so much, Shannon. I do have the distinction of being the only legislator here this morning, and maybe that's fitting since I'm a physician, but I am grateful for the opportunity. And I appreciate the acknowledgement of the day of September 11th. I lost one of my dear childhood friends in those towers. And it also happened to be the first day that I operated as a new attending at Abbott Northwestern Hospital. So it's a day that is just a landmark in all of our lives. And I think about my old friend often, but especially every September 11th, I miss him dearly. It's so exciting to hear from these healthcare leaders and be reminded of our proud tradition of very effective public-private partnerships in our state. We've learned a lot about the importance of public health this year and the social determinants of health over the course of this COVID crisis. And I think one of our priorities has to be to continue to invest in the areas that keep our people resilient and healthy. And that's public health, of course, in part, but it's also education and housing and environmental protections. Healthcare per se is probably only 10 to 20% of our actual health. So we need to be thinking in the big picture. None of this exists in a silo. Everything overlaps and impacts each other. We've also learned a lot about COVID over the course of this year. Minnesota's done a really good job, I think, of keeping the virus at a level that has not completely overwhelmed our capacity. But our hospitals and our practices are stretched very thin. And we don't want them to be punished for providing care in an unprecedented environment that they weren't used to. We've learned a lot about the standard of care of how to treat patients with COVID, and that is still evolving. And with that in mind, I do think that we need some liability protection for our hospitals and providers, excluding, of course, criminal behavior. We don't want an unprecedented public health crisis to have a chilling effect on our providers and our hospitals' ability to care for patients. I appreciated also some conversation about the explosion of telehealth and the thought that we really need to evolve into a future new normal. We can't go back to what we thought was normal. This is a potentially transformative moment in a positive way for us. This has been very difficult and it will continue to be difficult, but we can come back better. And I think the advent of telehealth, we had been experimenting with it when thinking about our rural communities and the increasing difficulty of access for them. But this has implications in many different areas and the potential to help us rein in cost. So I think that is an exciting development as well. So those are my top of mind thoughts this morning. I'm grateful to listen to these leaders and to be a part of this conversation. Thanks for including me this morning.
Great, thanks, Kelly. Thanks for your leadership as always, and for your commitment here to Twin West, because it is very valuable to have your insights and to have your ear. Representative Morrison is one that really truly works across the aisle and looks at how do we figure out how to best serve our community and the state of Minnesota. So now we are now it's time for the question and answer session of this. We've gotten some great questions already, but I would encourage you, please use your Q&A bar that you see at the bottom of your screen. You've also seen some people have used the chat bar. That's fine as well. It's just a little more difficult to toggle back and forth between the two of them. So, we have a couple of questions, and I'm even for the sake of those that are on the phone, it's difficult to see the chat bar. So we will answer the questions as you have brought those to our attention, and I will try to do my best to direct them to either Mary Jo, Lisa, or Representative Morrison. So I would say also, if you've got questions that are of the legislature of nature, please feel free to put those in your Q&A bar as well. So, all right, ladies, here we go. The first question was actually submitted around how long does somebody have to wait to give plasma after COVID. So Lisa, I think you had an answer to that. Do you want to just state that so that everyone can hear?
Yeah, Mary Jo and I both answered, and so we are completely aligned, free of symptoms, and 14 days is earmark. We've often said 14 to 27 days. There are many enrolling in those trials. Just please consider donating. Mary Jo, did you want to add anything?
No, please consider donating. And sometimes it's a bit difficult to interpret when you're symptom-free because the symptoms, they're so broad across COVID. So always work with your primary care physician or your local provider, and they can help you sort through the details. But please consider donating. This is one of the most impactful things we can be doing as a society to help aid the advancement and treatment of COVID-19.
Great. Thank you, ladies. We're going to stay a little bit on that topic because we're talking about symptoms. There was another question around what are you seeing in children, specifically that of teens. They're saying teens aren't affected by this, but can you give a little bit more insight on children in general and how what you're seeing from COVID? We can go whomever wants to tackle it
I'm
first.
happy to start, but maybe we should ask the physician on the,
right.
on the call. Because of course I am not a clinician, I'm an administrator with Mayo. I would just say, I think there's still so much that's not known. Early on, the incident rate in children was very, very low, surprisingly low compared to other viruses that we've seen. That has changed some as we've changed our testing strategies. But I think our understanding of this will continue to evolve. There's definitely a broad school of thought that children have a different kind of molecular makeup that makes them more resistant to the to the internalizing viruses. That does vary by individuals and by age. So I think there's a lot more to know, but certainly the incident rate in children, especially as you look to that 12 and under, remains lower than we see in the other populations. And please, others, feel free to chime in.
I think Mary Jo answered that well. And again, also not as a physician. I'm not sure Kelly would like to or not in her different role here, but we are learning rapidly, and we are working hard to ensure the community has facts, not noise, in what is out there for everyone. So we will continue to learn and share and work very hard to bring credible information to our communities.
I think you're both exactly right. I think that we're still learning. And as Mary Jo emphasized, that our testing has changed, so we're learning more as we test more people. There's an article in the paper this morning about, I think it might have been in the New York Times, it's either New York Times or Strib, about the incidence of serious consequences and sequelae for some young people who do contract COVID-19. So the incidence of death and serious sequelae is much lower in young people, but it is not zero, and it's higher than we initially had thought. So this is not a benign disease for young people. So we need to continue to be cautious on that front as we learn more.
So keeping in kind of on that perspective, there's a question about specifically schools. So can you give some of your thoughts as we are returning to school, some of it in a hybrid approach, some of them in a full-fledged approach in person? Just thoughts that you're seeing regarding what schools are doing. How do we report this? How do we, this probably isn't your space of expertise, but there is still a lot around concerns of students going back to school. Any perspectives you could share on that?
Yeah, maybe I can start, and Mary Jo, please feel free, or Representative Morrison, to add. I would just offer that it isn't obviously the set expertise of probably any one individual, and we do know that our schools are taking it very seriously. They're following guidance and are making absolutely the best decisions, based on the best science and the best counsel that they can possibly make right now. We are thinking about it not only through the lens of a provider who will care for our communities, but also as a major employer with many employees and school-age children who don't have the option. Despite virtual health expansion, when you're a nurse, largely you don't have an option to work from home. And so as we think about how do we support, not only as an employer, to ensure that our employees have the best advice, the best safety protections and the like, how do we ensure that we support schools in their knowledge and information? And I would just offer, it is a difficult, we've used the word unprecedented probably too much, and yet it is the right word. And I believe that our schools are working very hard and making really wise decisions, and we'll learn more as we go here.
I couldn't agree more with Lisa. We work very closely with the school districts in our geographies, and just to use as an example, the Rochester Public School District has done a fantastic job, I think, of evaluating the situation. They operated a summer daycare program for many essential workers very successfully by focusing on safety protocols. We work with them to help enable them, to provide advice, sometimes supplies, but it is a very difficult set of scenarios they're working through, and we're here to help and provide the best medical guidance that's available as they look to make decisions.
Great. Kelly, anything you want to add to that?
Well, I think that the Department of Education and the Department of Health and the governor have really came up with a well thought out plan based on the best available science and information in terms of mostly, providing some flexibility for different districts depending on what the circumstances are there. Mostly having our youngest learners being primarily in person, and then hybrid or distance for the older kids. Makes a lot of sense. We need to keep our teachers and staff in our schools in mind in making all these plans, obviously. So I think we have to stay flexible, but so far so good.
All right. So we will shift a little bit more, although Mary Jo, you just talked about the safety protocols. Can each of you give a little bit of perspective on, one of the questions was around masking up, right? That there's been a very strong campaign. There was obviously mandates around masks, but we also know that that's all around personal choice. And so thoughts as we continue to learn and evolve more on the masks and their relevance, their importance, the significance, anything like that. So Mary Jo, you want to start for us? And
I do. Mask up. Minnesota, that is my message. Do I personally enjoy wearing a mask? Absolutely not. Is it the single biggest strategy that has impacted our ability to bend the curve? Without a doubt. As we put in place dual masking, both for our staff and for our patients, we saw our spread drop almost to zero. And it really is isolated to people in break rooms who are taking off their masks and eating lunch together, or a situation like that. Masking is important. Please mask up.
Mask up, Minnesota. We need to wear masks. The science is there. You wouldn't let your 16-year-old drive without a seatbelt. Mask up. It really matters.
Okay. Kelly, I'm guessing you have the same comment.
I do, ditto 100%. But I think it's important to add, there's been some conversation around Dr. Michael Osterholm's comments about masking, and he added some nuance to it. So I think it's important to note that he has absolutely advocated for masking up in public, and particularly in indoor spaces. His point was that we don't want to have a false sense of security if we're masked up, that if we have masks, we can get together in big groups and be very close together, because there can still be some leakage of respiratory droplets outside, depending on what kind of a mask you're wearing. So we still need to be thinking about social distancing in the context of that. But absolutely, the science, the evidence, this shouldn't be a political issue. We just need to mask up to get through this. It's a new fashion accessory. Come on, put your favorite team on.
And there are a lot of them out there, right? You can choose whatever fashion you want. I think it's fascinating. Even my 7-year-old daughter is asking me, Mom, I want this particular mask because it has this on it. So that's fun. So, all right. One of the questions here is really around, can Blue Cross Blue Shield or any other insurance cover, should they be, or how do we cover the cost of telehealth? So this is outside of the actual visit, right? Computer, internet access, the whole accessibility side of this. As telehealth increases, what about those populations that don't have that type of access? Who wants to take this one first?
So maybe I can start, but what I can't do is answer the question for what Blue Cross will or won't do. So that probably wouldn't be a question I could answer. What I would offer is an example of where I think providers and payers and the community could come together and ensure that our patients, the community, have what they need to access telehealth. Largely our community, if you look at internet access, cell phones, which many used for their virtual visits, and some virtual care doesn't require the computer, but can be done over the phone. We have seen by all of us, I know Mayo had this as well, just an explosion of telehealth care because patients did find ways to ensure that is accessible. One example that I would offer where we've had great payer partnership with is what we call hospital at home, where during this pandemic, to open up capacity, we created a program of delivering medical surveillance tools like scales and blood pressure cuffs and the like to have patients monitored in their home. As a provider, we were able to provide that equipment to patients, and working with payers, have reimbursement that allowed for us to offer hospital at home for those patients that are right in the middle. They come into the ED and they might need hospitalization, but they're not quite there and they're not safe enough to go home. And we were able to deliver hospital at home care to them. This is still a service we are studying and learning to expand. It's an example where the payer through the provider could enable equipment to them. And do I think payers should ensure that their members have access to care? Absolutely. Whether that's through a computer or another tool, we'll have to work through that together.
I couldn't agree more. It really requires partnerships across providers and payers and the community. But I might just add a different twist. One of the things that really enabled the great advancements in telehealth, such as what Lisa discussed on really ramping up at-home monitoring and other things, was the state waivers that were put in place that allowed the flexibility of licensure to be able to deliver these services. And if I had 10 pleas, I would say, please, let's find a way to leave this flexibility in place so that we can continue to advance based on what we learned during this pandemic and really accelerate this electronic capability to reach patients. They'll have such an impact, both on the affordability piece, the health and equities piece, everything. But we really must be able to maintain this flexibility with the waivers that were put in place around licensure during the pandemic.
Great, thanks, Mary Jo. Anything else, Kelly, on that part?
Well, I think it does highlight some of the inequities, again, both in some of our urban cores and in our rural areas about internet access, and ensuring that we're investing in that so that everyone in the state has access.
Great, thank you. So there were two questions around collaboration. I'll tackle the first one first, and then Kelly, I'm just going to give you a heads up. There's a hard-hitting one coming your way. So, so many view healthcare as very competitive, right? That the healthcare systems are very competitive with one another. But now more than ever, we've seen tremendous collaboration amongst the healthcare systems. Can you give a little bit of perspective as to the philosophy around competition versus cooperation, and when it's been making sense to stand the ground on either one of those? So, Mary Jo?
Yeah, I mean, Shannon, I would say that a collaboration is always at the forefront. I mean, Mayo Clinic has put their entire reputation around collaborating with providers in the region and across the world. So I think you can kind of overplay some of the competitive nature of healthcare. We share patients on a regular basis. Our providers are on panels trying to discover the new and greatest approaches to things. Collaboration is absolutely key, and it is alive and well in our organization throughout the state, and we will continue that regardless of pandemic or not.
Great. Lisa, anything to add to that?
Yeah, a couple things, because I mentioned it in my comments that coming to Minnesota 3 years ago, I experienced a healthcare community that uniquely stood out with collaborative approaches. I see that playing out in mental health and children's care and the affordable care communities work that we're doing to identify social factors that impact health. I see it with Allina Health and Mayo Clinic. I see it with throughout the entire community. So there are always ways that we can do a better job, and where we need to collaborate for the community, particularly with what we're facing. And you know, we lit the world up with systemic racism and social inequities with what happened here. We have to lead and collaborate differently, which is why I had mentioned those community principles for how the collaboration and the compact of how we're going to come together becomes just all the more important. And we will look for feedback and input where the community needs us, because we're assets of the community, to work differently. So thank you for that question.
All right, Kelly. So now that COVID is here to stay, shouldn't the legislator and the governor follow Mayo and Allina's example of working together to manage our next normal? What bipartisan steps have you seen that have been taken already to end the emergency standing and help mitigate the economic fallout of all that's coming? And what should be done in the future?
That's a biggie. My internet seems to be unstable. Hopefully you can hear me.
Okay.
I think that, you know, all 50 governors and the president have declared states of emergency. Wisconsin is the only outlier right now because the Supreme Court overturned the governor there. So the emergency is not over. And I think it's appropriate still that we are in a state of emergency. It enables flexibility. It has enabled some of these very important public-private partnerships that have advanced our testing in Minnesota, among other things. The legislature did come together to provide a lot of healthcare planning and small business relief and protection for our first responders, among other things. So I think there's been more bipartisan collaboration than maybe the media would lead us to believe. But of course, we have to keep working together. We have to stay flexible as we learn more going forward. But I think that, boy, I would love everyone to put their partisan swords aside right now and come together to manage this public health crisis together.
Great. Thanks, Kelly. One other question, really more of a general question on what are your thoughts on the unseen problems surrounding business closure and business shutdown? So as you all know, that there are many businesses that were forced to shut down. That has a lot of unintended consequences that to the employees of that business, to the overall economic structure of our state. Any thoughts that you have particularly on what you're seeing as some of the unintended consequences of business shutdown? Who wants to try that one?
Yeah, so I'm happy to start, and we know there are many implications, and we had to do what we did. You know, when the business community, when we had closures, when we discontinued our elective, as Mary Jo pointed out, scheduled procedures, because nobody typically does it, you know, for fun, that elective procedures, we needed it to allow preparation. And as a healthcare provider, I just want to say thank you to all who supported our preparations. We needed to get personal protective equipment into our community. We needed it for our staff, and we needed it for patient care. And we needed to plan for, at the time, what we were predicting, and the models were showing a peak that might make us look like Italy or New York as early as late April. Now, more information became available, and some of the efforts we did prevented that, and thank goodness they did. Ongoing, as we look at the impact, I mentioned layered crises. It's really difficult. Our business community, our people's employment, their healthcare coverage, their mental health and well-being requires they can be productive in society with jobs and ways to support their families. So I would just offer, as a healthcare provider, the thing that we worry much about and are working to ensure care, hopefully collaboratively across the state, is the mental health implications of all of this are real. Likely many of us on this call today have been managing through in ways that parts of our community just can't and aren't. And so I would just offer, I think you asked the question, what are unintended consequences? And I would add mental health care and making sure that we're supporting one another and encouraging our neighbors to do the same.
Great. Any other comments, Mary Jo or Kelly, on that one?
No,
Okay.
that was
No?
fantastic.
Okay,
Thank
great.
you, Lisa.
There is a question, Mary Jo, specifically to you and Mayo. Can you give us a little bit more insight on the vaccine development and distribution? That's a hot topic on everyone's mind around where is the vaccine development and when can we get one, right?
Yeah. Yesterday is when everyone would want it, right? I mean, it's really important to think about the vaccine as a bit of a journey. And it's extremely important to let the science and the rigor of the science play out so that we can get to a point of offering a safe and effective vaccine. There are multiple vaccines under development throughout the country. Mayo Clinic has 4 that are in-house that are preclinical candidates using different types of delivery and platform. It's all part of that pivot of 2,000 scientists to really come up with novel approaches to dealing with COVID. It's really unknown how many of those will go to clinical trials, maybe 1, maybe 2. But there's a lot of work that is done that doesn't result in an endpoint of a vaccine that is no less critically important. So all of these efforts that you hear about, and it can get frustrating not to see them progressing more quickly, really contribute to the science and are so important in our development and understanding, both for treatment, prevention, and ultimately a vaccine. So the other good news is the state of Minnesota is very well positioned around vaccine distribution. I know all of the providers in the state are working through various plans, but we have such a history of large-scale flu vaccines and other things that I think we'll be able to play off that infrastructure with some tweaks, given the curveballs that COVID has thrown at us, to really be very effectively and efficiently set up to be able to deliver that. Mayo Clinic, in addition to the vaccines that we are developing in-house, we are registered to be a clinical testing site for many of these other vaccines that are out there. Companies will eventually choose the sites, but we think we're in a very good position to be part of multiple of these developments that we'll see coming down. We have the Rochester Epidemiology Project, which most of you probably aren't aware of, but we've had a very stable population and been able to look at longitudinal health records of that population for a period of time that just allows all kinds of data, research, analysis to be done. And it's very well positioned to help us understand the genetic differences and how the genetic differences in the population impact their reaction to a vaccine. So I don't have good news. I think it's going to be a journey, and we're working hard to get there. But please keep in mind that what we're learning along the way is extremely important and a necessary part of getting to an ultimate solution.
Great, thanks, Mary Jo. Any other comments on the vaccine component from Kelly or Lisa? Okay, I want to make sure that we're cognizant of time. We've got about 10 minutes left for questions. I have 2 questions remaining, so thank you all for submitting your questions. And by all means, if you've got more questions that you want answered, you can certainly just email me directly at Shannon at Twin West, and I'll be happy to get it to the necessary people. The request has also been that we could share your slides with those that were on the phone. It may not be easy. I'm seeing the shake of the heads, yes. So we'll get those slide decks put out on to our website as we've done in the past, and then also the video recording of this conversation. So one question around the Star Trib just recently wrote about the allocation of PPE and masks. Can you talk a little bit about the access and ensuring the access to PPE and masks that are so critical to your workforce, but to the community as well?
Yeah, I'd love to take that one. And Lisa, I'm confident you'll have stuff to add. This has been a key area of focus of healthcare providers, certainly across the country, but very much so in the state of Minnesota. At Mayo Clinic, we did some advanced modeling that helped us look at the utilization, not just of PPE, but of hospital beds, ORs, ventilators, and applied AI algorithms across it. So we have a very predictive model. We know what's coming in the front door, and we know what resources will be utilized as a result of that. And that has allowed us to manage our census, be able to safely care for COVID patients, make sure we have enough capacity for those that are predicted to need more intensive level of cares and et cetera. And it has served us unbelievably well. And PPE is part of that AI data-driven approach. And we use it to implement further conservation if needed, redirect supply chain in ways when we start to see unusual trends happening throughout this phase of the pandemic. We've been, I'm proud to say, very successful at managing this. We have an outstanding supply chain group, and we are working hard not just to be reactive, but to be forward-looking so we can continue to serve the needs of the patient safely while we operate throughout this pandemic.
Great, thanks, Mary Jo. Lisa.
Predictive modeling is really key here. It is so important for all of us. And as Mary Jo said, we are similarly looking at what we have in hand, what we are likely to need, the mix of the patients that we're serving. This is actually an area that we've learned a lot over the last 6 months. And some of that learning has been done as a community, as our informatics teams have come together. The only other thing I'll add to what Mary Jo said is we've taken very seriously to make visible to our staff the number of days of PPE on hand by type. And so we publish a dashboard that is available for our staff so they can see this is their PPE and we want to make it safe for them. We've also done very routine PPE surveys to hear from our staff and nurses and frontline clinicians. Our last survey had a 20% point increase in people feeling comfortable that they had the requisite PPE. It's an area we will stay on and watch every day and ensure predictive tools that ensure our ability to take care of patients and keep our teams safe.
Great, thanks, Lisa. I can imagine that plays in a lot to the mental health of your workforce, right? That they're feeling safe themselves. All right, the final question for all three of you ladies is to really think about, we have an audience full of business leaders here today. If you were to give them one lesson learned that they could take and implement into their business or that they could benefit from, what would that lesson learned be? And then the final component of that is if there's any way that businesses should be even more engaged, what should that look like? So lesson learned, and how should the business play an even greater role in this whole piece? So Lisa, we'll start with you, and then Mary Jo, and have Kelly close us up.
So first, I would thank the business community. Many of you came together to help us during the time of the community's, business closures. And many of you used that time to actually repurpose and provide PPE to the hospitals, to look at innovative ways to support us. So huge thank you to all of you. As you continue to go forward, look for the facts and information to share with your staff. Help be a source of truth so that they can manage their public health and therefore the health of your business. Ensure they get their flu shot, ensure you get your flu shot, and follow all the public health information that's out there. Employees really trust their employer. And I think that is a way for us to keep working together and make Minnesota a safe place and a faster recovery state in our country. So, and thank you for what you're doing to support healthcare.
Great, thanks, Lisa. Mary Jo.
I don't know that I could say it any better. Lisa hit it all. Huge thank you to the business community. Enable masking, social distance where possible, get your flu shots. Maintaining a workforce is going to be a challenge over the next 6 months. And following these safety protocols and being that anchor of consistent information is going to be critical to all of us to have business continuity.
Great, thanks, Mary Jo. Representative Morrison, a couple more comments.
It's tough to follow these two. Great comments, and I echo the thanks to the business community for all that you've been doing and been enduring during this time. And I agree, encourage encourage masking among your employees. You know, there are the easy public health posters that can be posted. It's not on businesses. It's what the government's making all of us do. We just have to mask up. And getting flu shot is really important right now, more this year more than ever. Again, another article in the paper this morning about the potential for a twindemic this fall and winter as we head indoors. We need to do everything we can to keep our flu cases to an absolute minimum this year, and continuing to do what we need to slow the spread of COVID obviously will help our businesses thrive better. So happy to be here this morning with all of you and with these leaders. Thank you so much.
Great. Thank you to all three of you ladies for your insights and your tremendous service to the community. And so you'll see the upcoming events listed, the few events that we're able to do, most of them being virtual. But I want to close also in the same respect that many have heard and shared already. In that 19 years ago, our country was tested. We were tested to the brink, and we saw the grit and the resiliency of this country. We saw first responders, volunteers, people that came out of the woodwork to support one another. We're seeing that over and over again today, although I would say those heroes of 19 years ago remain to be heroes, but we're added with a whole new force of heroes. And many of those are those that are frontline workers in the healthcare industry. So I want to express my sincere gratitude, Mary Jo and Lisa, to your every one of your workforce, every member who is really putting their own health and safety on the line to help us as a community, as a region, as a country overcome another crisis. And we're really facing a dual crisis here, the dual crisis of tremendous civil unrest accompanied by COVID. So Kelly, again, thank you for your leadership in that of our state legislature, our governor. We wish you all the best as we continue to battle this dual crisis. And to all of you as businesses out there, when we talk about resiliency, we're seeing this day in and day out from our businesses. The Chamber has been overwhelmed with the opportunity and responsibility to help our businesses of all sizes, but our small businesses, our minority-owned businesses, many of those companies are facing tremendous challenges, and the tenacity and resiliency that we see is just amazing. So it makes me very proud to be here in the state of Minnesota, where our healthcare is truly second to none, and we are so grateful for all that you guys are doing. So we wish you all the best, and we hope to see you soon, especially at our next October Issues and Insights, which will be focused on COVID and higher education. So we'll get a little bit of perspective from higher education as to what COVID is having effects on higher ed. So thank you to everyone. Have a great day. Thanks again to our fabulous panelists and our sponsors.
Thank you.
Yep, bye-bye.
Thanks. Bye-bye.
All right, thanks. All good, Beck?